Hello, I'm Debu Tripathy from Cure magazine. I serve as the editor-in-chief, and I'm here in San Antonio giving updates of trials that were just presented today, just a few hours ago. In the area of hormonal therapy, which was the focus of this morning's topic, a general set of topics, there was a trial for patients with metastatic breast cancer who were receiving a drug called Faslodex, also known as fulvestrant. This is a drug that we use after progression on other drugs like aromatase inhibitors like Arimidex or Femara or Aromacin. And this drug has been shown to be effective in delaying progression and is now a standard of care, but we haven't really known what the proper dose was. When it was initially approved, the 250 milligram dose is what was approved on the basis of some of the earlier trials, but it became apparent shortly thereafter that 500 milligrams seems to give you the levels that you might want to really inhibit breast cancer cell growth. So a trial was launched to compare 250 to 500 milligrams, and the results of this was presented and published a few years ago, and it did establish 500 milligrams as the better dose in terms of delaying progression of cancer. At today's meeting, Angelo DeLeo, who was one of the main investigators on this project, presented an update and now has survival data. Do patients actually live longer with the higher dose? And the answer is yes, they do. There is an improvement in the mortality rate of patients that get the higher dose. And this difference even comes after patients may progress and go on to other drugs. Chemotherapy, for example, which is commonly used if people progress on different hormonal therapies. And despite that, patients actually live longer if they were assigned to the higher dose. So this doesn't really change practice because most oncologists now are using the higher 500 milligram dose, but it now provides us a greater justification for doing that. It does require that you have an injection on each side because of the higher dose, and so sometimes people were reluctant to do that, but now we know that it actually has a survival benefit. So it's not a huge earth-shaking result, but it does really confirm that that's the better dose. And in fact, the name of the trial was called Confirm. So there you have it. That is the established dose.